Welcome to the IFRS patient education videos. Today we're going to talk about what can be done for infertility in rural areas. Infertility actually is not a medical problem, but then it can cause significant stress, which is psychological, financial, and even medical stress. And the definition is that if a couple stays together and are not able to conceive for 2 years, and despite massive advances in IVF or many of the modern techniques, laparoscopy still has a significant place in evaluation of infertility. But the good news is that before the era of laparoscopy, the diagnosis was very difficult for most of the treatable conditions. What was happening earlier? Earlier, they used to do a special X-ray called a hysterosalpingogram, which has a very poor sensitivity, only about 65%, and is not even specific. But then many of the conditions that is treatable that can lead to pregnancy cannot be diagnosed without laparotomy. But unfortunately, laparotomy or making an open surgery with a big incision is a big procedure for a diagnostic procedure and is not acceptable to many of the women. How common is this problem? About 6 to 14% of couples have infertility, and almost 3/4 of the causes are in women. And the good news is that diagnostic laparoscopy can lead to probable treatment in half these cases. And if you add that to having a look inside the uterus or what is called hysteroscopy, then we can diagnose many other problems which cause infertility. Like there are polyps or tumors or adhesions. These are inside the uterus, which is very difficult to diagnose with any other means. Like if you look at here, there is a small growth in the inside of the uterus, and resecting that will lead to very significant improvement in success rate after treatment, which varies from 17 to 19%. Although specialized instruments are available, you can use the ordinary instruments which are there for urology for treating these conditions. There are many causes for infertility, which can be either hormonal or ovulation disorders. It's related to the tubal or fallopian tube, where there's blocks. Then what is called endometriosis, where the uterine endometrium or uterine lining tissue is found elsewhere. And then sometimes the cervix is narrowing, but very often the cause is not known or unexplained. One of the common conditions which has been increasing in frequency in recent years is called polycystic ovarian disease. Here the ovaries is filled with a small cyst or collection of fluid which compresses the ovarian tissue and causes infertility. The good news is that you can do laparoscopy and puncture these cysts, and it gives a time span of about 6 months, during which the patients can conceive. And again, there are medical treatment like medicines like metformin and so on, which are available for treating these. And the laparoscopy, what do the doctors find when they go inside? Very often there are a lot of adhesions, inflammations, or anything which can block the tubes. And what we do is we inject a dye or colored fluid from the uterus and see if it spills into the peritoneal cavity. If it spills, it means there is no block. If there is a block, one of the simple things which we do is go to the orifice of the tube from the uterus and flush it under high pressure. This flushing of normal saline very often relieves the small blocks and helps the women conceive. And then there are a variety of cysts which form in the ovaries. These also can be very easily removed with the laparoscopy. Then there are adhesions, which can again be relieved with the laparoscopy. And for unexplained infertility, there are non-specific treatment which do help, like diet, exercise, stopping smoking, limiting alcohol intake, and avoiding certain medicines like anabolic steroids, and of course, staying off drugs. In this context, the gasless laparoscopic surgeries have a big advantage because it's done with a very small scar in the umbilicus. Umbilicus is a natural orifice. When it heals, there's hardly any scar which is visible. So it's almost invisible surgery. And all the things which you have been talking about earlier are possible through laparoscopic surgery. And then again, because we don't use dry gases and other things, it's better than laparoscopic surgery because there's less post-op pain and adhesions. And to top it all, it is less expensive. So this is one of the things which we advocate in rural areas, doing gasless surgeries for infertility. Also, we combine it with having a look inside using urology equipment. And this results of conceiving from almost 17 to 90% in some cases. So it is all these available in any remote or rural areas. Thank you for watching.